Okay.
Good afternoon, students. We've got Dr. Sneha Goyadani here. She's a practicing occupational therapist in Nagpur, and she's got her own pain relief clinic. She'll be addressing us on this webinar today on the posture and ergonomics, importance of posture and ergonomics for the hospitality professionals. So going back to Dr. Sneha, please continue with your session, ma'am.
Thanks, Poonam. Hello, everyone. A very good afternoon to all the participants. Myself, Dr. Sneha Goidani, am here to present this talk on posture and ergonomics for hospitality professionals. Now, before introducing myself, I would thank the organizers, School of Hospitality and Tourism Studies, D.Y. Patil University, and also to all the participants attending this. Now, I would like to just brief about myself. So for that, yeah, you can see my screen. So I'm Dr. Sneha Goidani. I'm a certified ergonomic consultant, and I'm a registered occupational therapist. I have done my occupational therapy graduation, bachelor's from GMCH Nagpur. I'm an expert in pain management, acupuncture practitioner in Nagpur. Okay, now I would start up my session. Okay, this is just about my introduction. Now I'll just start up the session and not waste your time. So what I would like to tell you is about ergonomics. Now, what is ergonomics? It's like your fitness to your environment, to your workplace. The workplace can be your house, can be your professional workplace, can be your leisure workplace, any of the workplace. So your fitness to your workplace is your ergonomics. Your physical fitness and sometimes also your psychological fitness to your workplace is also your ergonomics. So ergonomics is the study of person's fitness to his or her work environment. It contains a lot of human factors. What factors that you can study here is ergonomics at your workplace. Could be a workplace environment, your mental demands, your physical capabilities, and what your task demands you to do, right? So all these four things contribute to your ergonomics at your workplace. Now, again, I'm telling you, it's not just about your workplace professionally, but also the time you spend at your home, in front of your mobiles, in front of your laptops, in front of any of the other places than your workplace, and also definitely the majorly your workplace, right? So musculoskeletal pains. Now I'm here majorly speaking on problems and issues that may occur due to your profession. As you all are from the hospitality department, so and you all are the hospitality professionals, so we'll have to majorly consider your work profile and your pains, right? So you can see here musculoskeletal pains. Muscle and skeleton is joints and bones. So muscles and bones, tendons and ligaments, all these pains are considered here, right? You must have heard a lot many things about cervical pain. That is pain in your neck, backside of your neck, your shoulders. Then back pain, frozen shoulder, tennis elbow at your elbow joint. Then migraine, wrist pains especially due to carpal tunnel syndrome. Then sciatica is your hip pain, could be. Then even your back pains, lower back pains, knee pains, ankle pains, heel pains. Then there is tingling numbness in your hands and in your lower extremities due to the pain in your cervical and your lumbar. Lumbar is your low back area, okay? Then there are pains of fibromyalgia, which have no indications of specificity. It may occur anytime, anywhere, right? Now, causes of these muscles and skeletal pain. Mainly in young professionals we can see, or people doing one kind of a job every day, we can see due to wrong posture or micro trauma injury. Trauma is any accident, okay? So there can be micro accidents which even you don't know, but it happened, right? Micro injuries which even you can't say, अरे मैंने ऐसा किया था तो मुझे ऐसा हुआ क्या, अरे I didn't get it. So there are certain pains, they are called as micro, and then they accumulate. बहुत दिनों तक हम वही इंजरी करते रहेंगे तो वो accumulate होता है, and that forms a macro. माइक्रो का मैक्रो बन जाता है, बड़ा इंजरी बन जाता है, right? Then there are strains, sprains, ligament sprain सुना होगा आपने, और मसल जब पुल होती है तो उसे स्ट्रेन कहा जाता है, लिगामेंट जब पुल होती है उसे स्प्रेन कहा जाता है, राइट? वेयर एंड टेयर, टिश्यूज अंदर जो रहते हैं, लैक ऑफ एक्सरसाइज, स्ट्रेचिंग, repeated strain disorders या फिर repetitive strenuous injuries, RSIs, ये सबसे इम्पोर्टेंट है कोई भी प्रोफेशन में, राइट? Nerve pain, internal pathology diseases, degenerative osteoarthritis, psychosomatic referred pain, idiopathic जिसका कोई रीजन नहीं है. Now, to prevent, it is important to have a good ergonomic lifestyle that will be going through. Then the correct posture, that also will be going through. Exercises and stretching, उसका कुछ एक briefing हम कर लेंगे इस सेशन में. What are repetitive strenuous disorders जो हमने अभी देखा था? बार बार रिपीट करते हैं हम सेम रॉन्ग पोस्चर, रॉन्ग एक्टिविटी को, तो it causes repetitive strenuous disorders. अब यहाँ पे you can see in this cursor, this is the, see, वो शोल्डर को बार बार वही रॉन्ग पोस्चर में मूव हो रहा है, तो there is shoulder macro injury now, and the person is suffering with shoulder pain, back pain. This is now again elbow pain, right? Here you can see यहाँ पे redness है. This is in the next picture. Here you can see this is due to carpal tunnel syndrome. Repetitive use of your wrist on your tabletop can cause this kind of an injury. Then there is elbow pain again due to some wrong activity, pulling, pushing, or maybe any of the holding wrong activities, and repetitive activities, repetitive same strainers without exercising can cause this. Without the strength and without the conditioning of the muscle can cause this kind of. Then here, this is again one more common feature. This is known as hallux valgus. This I'm specially introducing because of your profession, and I'll tell you how. Now these are the vertebral column. We see the backbone. These are the two vertebrae, and here you can see all the vertebrae. Now you can just see, like, due to repetitive strain on your back or on your upper cervical area, wrong strains of the muscles and wrong pull and pressure on these, this can cause so many narrow of the disc, and then again when the disc narrows, the nerve gets compressed. So you must have heard about slip disc or nerve compression. This may occur in professions where you need long standing or long use of your lower back, and they are on a stress condition. And I would again repeat, stress condition happens when there is lack of exercise. Your muscles are not conditioned to do that activity, to get that, to tolerate that load which is on the bones and on the muscles, right? Here, this is the sitting posture. See, this is the wrong posture because again, you can see. But while you are sitting, you don't see yourself how much I am straining my back, right? But when somebody else is sitting, you can just imagine even this. See the hunch here? This is not at all good for your vertebral. And when you are prolonged in this position, definitely it will hurt. Upright, 90 degrees. This is also not a very correct again because the lumbar curvature here at the curvature is too much increased. And again, the load is not proper. This is the correct posture where you are taking a good support of your, usually the chairs have, nowadays the chair have this good support, right? Which gives you a good support at your lower back area, right? So this support is very important and this is a correct position. Again, if you want to lean back and if you want to relax a little bit, you can take a support and get yourself at the back, right? This is again a wrong posture. This, while sitting without a A, you can have a balanced posture and this can be a good balanced posture, right? Now, about the standing posture, see, you can see yourself, you are just swaying back. If you are swaying back, again, the pressure comes on your hips. Now, if you are too much of curvature on your lumbar back and if you are moving your tummy outside, then again, this is a wrong posture. Just getting it to. Then, if you check this, see the hunching. This is again a bad posture. Then here you are moving this entire thing is correct, but then again you are moving your neck. See, he's just moving the neck forwards, and again that is causing the problem in the vertebral column is running from here to right here. In the last figure, my cursor is moving. You can see the vertebral column is moving from here to here, right? So if there is incorrect posture and if there is any imbalance, it will cause the center of gravity, which is running the red line in the last figure. In the good posture figure, you can see the center of gravity changes and again there is imbalance in your posture and you will get some or the other musculoskeletal pains. Now, computers has been an integral part of all of us. Right now also we are into communication through computers, right? So this has been an integral part and we cannot deny and we cannot stay out of it. So just a fact, like when we were our ancestors, they were in that position and now we are coming to this position back again. So just realize how much strain and what our postures will be if we don't continue to work on our good posture, which was our upright posture, the central one. Right? See now. I don't think anybody would consider this as a correct posture, but maximum times when we are looking at the screen carefully and straining on the screen to visualize something, we are in this posture. Just consider yourself this, right? Your shoulders are at 38% of strain. Your neck is at 53% of strain, low back is 63% of strain. None of the parts are supported. Wrists are again 33. So again, wrist will suffer with carpal tunnel syndrome. Now, while sitting, this is the correct posture. Your back, first thing is your shoulder. Your shoulder should be back supported, right? It should be at this distance from the, you can use an armrest. See, you can use the armrest, which is very good while keeping it. And your armrest height should be equal to your table height. Okay, so you can try it on. You can elevate the chair height, or you can somehow, if reduce the table height, or do some modification, easy modifications, which can help you achieving in this posture. Your eye level should be at the level of the monitor so that you can visualize it without straining your neck too high or making your neck too low, right? And even your strain on the eyes will be lesser if you adapt this posture. Again, you have this is wrist is at good neutral position. Now you can also see her legs are in her knees are in a very good neutral position, right? So know where the strain is coming in her body. Definitely some mental strain is there because she's working, but no other physical I can find, right? See, again, this is a correct posture at 100 degrees, and this should be again at 100 degrees. So this should not be too high, or the seat should not be too low for her knees to be at a comfortable position, right? Do I need to see the raised hands, raised hands now? Or I should continue? Okay. Now, ergonomics while sleeping. Now, you'll all ask me, or you must have a question like, what about our workplace? But then you spend a lot of time in your sleep, at least 8 hours. I assume that you must be spending out 8 hours in your sleep. So that is a good enough time. And if you don't get a good sleep, and if you don't get a good and if you feel painful after your sleep, that means you are somewhere having some ergonomic difficulty, right? So we'll just see, and it is very important because if you are sleeping well, you'll definitely work well because you get a sound sleep and you will get a good start, right? So now see your bed, see the bed here. This is too much sagging bed, which we usually see. I shouldn't say, but I can see in most of the hotels a bed sagging. They're too soft. So like the beds, of course, we don't use them at homes, but I would even suggest the hotel industry should use good firm mattresses so that usually people don't get back problems or they are especially people who are coming for their work, like people like me. Definitely don't prefer staying in sagging bed the whole night because that causes a lot of back issues, right? See, now you can see that the person is completely going down, and again the center of gravity changes. See the spine, the curvature has changed. Every day, if you see the neck position, every day if this happens, then this will cause a repetitive strain disorder. There will be strain in the neck region, there will be strain in the low back region, and the person will definitely have some other painful issues. Now, too soft, spine curves downwards. Too firm, spine curves upwards. In this, the mattress is extra firm, very hard. So, not even very hard mattress is a good thing, right? So, this will cause a reverse bend in the spine, right? Again, the position is incorrect. Now, the correct posture should be, spine should be straight, the mattress should be not very firm, and it should not be uh, very firm, and it should not be very soft, right? It should be a medium. तो दबाने से थोड़ा दब जाए, आपके से थोड़ा pressure हो, you should feel comfortable, and that should be a correct mattress while sleeping, right? Now, if you see this pillow, this is too high, again the spine has changed the curvature. This is too low, again the cervical spine, the spine behind the neck has changed, and now this is a good height. The gap between the neck area and the shoulder area when you are in a side position while sleeping, the space should be covered completely, right? Now here you can see this is again a bad posture. This is too high a pillow, then this is too low a pillow, again neck going down. This should be medium, and actually the the support needed to our neck during sleeping by a pillow should be to the area which has a curvature and not to your head. Even if your head is without supported on a bed, it won't cause any problem. But then definitely this portion which is hanging, same way the spine which is hanging, lumbar spine, should get a good support while sleeping. You can even put a towel roll. You can roll a towel if you don't find a pillow of your height adjustment. You can just hold a pillow, make it of your and keep it behind your neck while sleeping or behind your lumbar spine, right? See, now again this is the same thing. This is the right one. This is the right posture. The height has been adjusted so properly that the spine is straight. The height is here. It is too high. Here it is too high. Here it is too low. And this is also too low. Here, see now, this is a very correct posture of sleeping in a side manner, right? The pillow is of the height so that there is no strain on the neck. The neck is not too high. It is not moving here. It is at a neutral position. See the hands, see the arms, and there is a pillow so that the hip doesn't move too on one side, right? So this is a very comfortable, and the knees are also bent. So in a sideline position, in a side position, you can sleep in this manner, or when you're sleeping straight, you can sleep like this. See here, this is in a neutral position again, and the either you can keep a pillow behind your knees, or a towel roll behind your knees, or you can even put it at the curvature area. One place either you should be doing that. That is a very good posture. You can do also one thing. If you find your pillow to be too height is very low, you don't need to go and buy another pillow for the same thing. What you can do in the same pillow cover, you can put in some bed sheets, soft sheets, and you can make it comfortable of your height, the gap which falls in between your neck, back, and your bed, right? Ergonomics while lifting. This is very important. Your profession needs a lot of lifting job. You have to pick up things and carts and various things, and then you even have to move it sometimes from one place to the other. So it is very important in your case. So what is causing the pain while lifting? You must have experienced some or the other kind of strain or sprain while lifting. If not so, but then definitely your profession will may cause you, right? So I don't say will, but it may cause you. So see, what is wrong in this position is that the person is completely bending and then lifting, and when the person is lifting the heavy load, the entire strain comes on the lower back, which is not ready for the lift, and again the spine may get traumatized, या फिर उसको इंजुरी हो सकती है, राइट? तो पॉसिबिलिटीज इन रिपीटेटिव लिफ्टिंग, और ये एक बार नहीं लिफ्ट कर रहे हैं, हम बार बार यही गलती करेंगे. So this is a wrong method, wrong posture for lifting any heavy objects, right? Repetitive lifting of heavy objects, twisting while lifting, then उठाना है सिर्फ नहीं है, उसके बाद हम ट्विस्ट भी करते हैं, शिफ्ट भी करते हैं लोड फ्रॉम हियर टू देयर, right? Without conditioning, without a warm up. In a gym, if you are lifting weights and you are twisting and all that, you have done the warm up, and then you are conditioned. Your brain is conditioned that yes, I am exercising, right? That is a different issue. Still, you may suffer from some injuries are there also, but then here the chances are more. Poor lifting techniques, definitely this is a poor lifting technique. You are just lifting it anyhow. Poor lifting technique, lifting above the shoulders. You may just have to raise it above your shoulder. Then again your shoulder may suffer. Your lower back and your shoulders may suffer injury. Single lifting injury Single lifting with one-handed lifting a heavy object will definitely. Poor conditioning, this is what I'm telling you. If you are doing it without conditioning your muscles, if you're doing it without proper exercises, definitely you are going to suffer from some or the other musculoskeletal pains. Right? Now, this you can see, lift comfortably. The knees should be bent. You have to bend your one knee, move ahead, and then lift up object carefully. Avoid unnecessary bending. This is if you don't need, still if you are bending too much every time and regularly, once in every 15 minutes you're just bending without any reason, definitely there may be a cause. And avoid unnecessary twisting. If you should not twist with a heavy load, rather you should move your legs and shift to the other side, turn to the other side without twisting your low back. Again, twisting causes a lot of injury in the lower back. Right? Now keep objects close to your body. Heavy objects need to be close to you. If you're keeping it away from your body, this is close to the, if you're keeping it away and heavy object is away, definitely the strain is coming on your hands and your elbows and your shoulders. Use an aid for if there is kind of a lifter or any of the carts which you can use for lifting heavy objects, definitely go for it. Again, lift gradually, thoda thoda karke. If you can change, if you can thoda thoda karke agar uthane ka aapko option hai, you can choose that option. First take some weight and then take the other. If you don't have time, then lift it gradually, very gradually, and then very gradually, because you have to avoid injuries. See now, this is a proper way of lifting. Get close to the object, पास में आ जाओ ऑब्जेक्ट के, then gloves may improve the grip if required. Then ensure loads are lightweight, so you can distribute them and then lift it accordingly. Avoid lifting from the floor. तो avoid, अगर डायरेक्ट फ्लोर से नहीं लिफ्ट करना है, अगर थोड़ा और ऊपर हाइट से अगर आप उठा सके तो दैट इज better. You can keep the before only you can keep it at a, जो heavy objects है उनको थोड़ा अपने फ्लोर से थोड़ा ऊपर के शेल्फ पे रखेंगे, so it will become really easy for you to lift. एकदम ऊपर भी heavy objects नहीं होना चाहिए, एकदम नीचे भी heavy objects नहीं place करना चाहिए, so that lifting becomes easy and less strenuous for you. Bend at the waist. You have to bend at your waistline, right? यहाँ bend करना है. Use both the hands. Have a good grip, right? ये waistline पे knees को भी bend करना है. See, this is a very good. Now again, keep close to your body. Push up with your, फिर पैरों का pressure देके, then you can lift. Your knees, your thighs are generally stronger than your lower back. So use your thigh muscles, especially males have a good thigh muscle power. So you can use the muscles of your legs, of your upper region, thigh, instead of your lower back. Push up with legs, use forearms and thighs to rest the load. अपने thighs के ऊपर थोड़ी देर आप load को support भी कर सकते हैं. Get help if needed. Keep it tucked in, right? Pivot with your feet, not your back, right? पैरों का यूज ज्यादा करेंगे than your lower back while lifting any objects. Now this is again a lifting. This is not a weight, heavy weight, but again you can see you are doing, if your profession wants you to do this work continuously. Here you can see how the person is holding on 4-5 fingers. Again, the stress is coming every day. The stress is coming on the fingers, which are not usually conditioned, which are not usually in a good muscular power to support this every day. Again, there may be some or the other issues related to this, related to your shoulder, related to your elbow. See? So always adapt a posture. Maybe you can keep it in your front, or what techniques you use for this. I'm not well aware about it because I haven't visited any of your training institutes. So what you can do, you need to think about this and get into a very good posture. You need to analyze this and get into a very good posture where the strain is not coming repeatedly on your elbows, on your wrist, on your shoulder. I feel this is a more comfortable position than this one, right? Though he doesn't have any weight, but assume a bottle here. Now, ergonomic storage, you also need to store things, especially in the kitchen department or in the store departments. So, storage of, usually as I told you, heavy objects need not be stored at the up and down position. Seldom means जो हम बहुत कम रखेंगे इन जगहों पे, कहाँ पे, नीचे की जगहों पे और ऊपर के रैक्स में, और एकदम लोअर जो रैक्स है उनमें हेवी ऑब्जेक्ट्स नहीं रख के हम लाइटर ऑब्जेक्ट्स, और इफ रिक्वायर्ड कुछ भी मत रखें, राइट? स्पेयर में पड़े रहने दें उसको, या बहुत कम फ्रीक्वेंटली जो हमको ऑब्जेक्ट्स लगते हैं, बहुत कम कभी लगते हैं, वो हम नीचे रखेंगे और एकदम ऊपर रखेंगे, राइट? द कंफर्टेबल हाइट शुड बी दिस, डेली ऑब्जेक्ट शुड बी एट दिस लेवल्स, एंड थोड़ा फ्रीक्वेंटली यूज होने वाले थोड़ा उसके ऊपर और थोड़ा उसके नीचे रख सकते हैं, एंड जो बहुत कम यूज आते हैं उनको हम एकदम नीचे और एकदम ऊपर रखेंगे. Now, one more aspect which is very important, even at your workplace, you are using mobiles, which cannot be restricted. You have to use mobiles at your workplaces, at your homes, while you are in the college, while you are studying, or while you are teaching, anything, right? So nowadays, everyone is, most people are suffering from text neck syndrome. What is this? See the girl, she's bending and using her mobile, right? Now the signs of this text neck syndrome is tightness or stiffness across the shoulders, soreness in the neck, chronic headaches, postural change, numbness, tingling felt in the upper extremity, pain in the neck, back, shoulder, arm, hands, fingers, wrists and elbows. I think most people might be feeling this. See the posture? This is the text neck syndrome. You can see the amount of strain and see the posture, right? And now you can just lift it, support your hand, support your hand which is holding the mobile with the other hand, and this position is quite neutral to use a mobile. Again, the same thing. Use your hand, use your shoulders instead of bending your neck while texting or using your mobiles. Now this is again not, if you feel this is a good posture for riding bike and riding a car, again you need to have a good posture. At these angles while you are driving a car, right? Now stretching and relaxing when you are in front of a computer. This is a straight posture. You are sitting. You can relax. You can you can bend your hips in front. Okay, and then you can relax, or you can relax back. Don't relax like this. Head down position नहीं. Neck को कभी भी सामने की तरफ नहीं move करके आप neck को पीछे move करेंगे. In the last position. This is always more comfortable and more relaxing, and this will not cause more of a problem, and this will give you a good stretch, this posture, while you are sitting on a chair. Every half an hour you can take a break if you have a long sitting job in front of if you are on a front desk officer, if you are working more on your screen, you definitely have to relax every half an hour when you are in the least work position. These are a few exercises. We'll come to this later. Now with your feet, right? Again, due to wrong footwear or wrong walking or wrong standing position, this is a normal and these are the different. The alignments of your, these are the high, this is the normal arch of the foot, this is a high arch of a foot. When it is too high, this is a flat foot. So these are the consequences which can be turned into. See now, imbalanced body. There is some other kind of imbalance either at the foot level or at the knee level or at the hip level or at the vertebral level due to wrong posture at the cervical level or the head level, right? So if we correct it with the corrections can be done with using orthosis, proper footwear, proper orthosis. You can change the posture and you can balance it into a correct balance. Now this was what I was talking about. These are high heels, narrow heels, high heels. I think which is required for females, mostly in hospital or tourism, or you may require. I know I'm not very clear about it, but if you are using it anyhow, try to have a broader heel and a good footwear, because it may cause a lot of, see the amount of pressure. See the here at the fingers level, we call it tarsals and metatarsals. So at this level, the amount of pressure, the pressure points where you may feel the pain. Of course, the ankle, the heel pain. The heel starts. If it is more, see this is 2 inches and still 2 इंच की हील में ही देखिए आप कितना पूरा आपका जो पैर का जो एनाटॉमी है वो पूरा चेंज, पूरे बोन का अलाइनमेंट ही चेंज हो जाता है, राइट? The good form of footwear is this. If you want to wear heels, try to wear it in the form of wedges or platforms having a good heel. One more thing is, too bulky or too weighted shoes are not at all good. You should have soft and lightweight shoes, so that you don't have to lift the weight of the footwear also, because you have a very long standing time job, right? You have to stand a lot, and again standing with that much of a pressure and that much of a weight, and you have to carry it all the time, is not at all good. So you can use a comfortable footwear, which females. Now for the males, again, they should be broad enough here, right? So that you don't suffer, as I told you, one hallux valgus. Your toes should not, the shoe toes should not be pointed at all. This pointed should not be. These are the square should not be there. The pointed should not be there. Then this is again a very wrong type of a footwear for men. They should be rounded. They can be oval. They can be rounded. They can be almond shaped, right? And giving a good room and good proper aeration to your foot, which is very important. Now, when it is tipped, the front of your when it is the footwear is tipping and it is tipped and is pointed. See what happens is here. This is a normal here. This also changes its position, and you can feel here the pain in the bony area, right? So you can use it this way. You have to use the orthosis. If you have already developed this, you have to check your feet, and if you've already developed, you need to go for some orthosis and a proper footwear which is rounded and which is not pointed, right? And even you can use this orthosis so that you can avoid the hallux valgus. Now again, when you have a very long, standing posture, right? Long standing job, like in case of hospitality, you have to stand for hours during your working hours. So this is one more thing which is called as varicose veins, which usually develop. So to avoid this, you need to take frequent breaks in the form of, you can even sit, you can walk, and any time of breaks you can just hold your, the एक पैर को पीछे से उठा के you can give it a good pressure, and you just change your posture from a long sitting to long standing to any other posture, maybe walking. You can take a walk, छोटा सा एक walk लेके आ गए, but move your calf muscles, move your feet frequently to avoid these kind of situations. A few exercises for your lower extremity. You can do squatting. अगर आप ऐसे squats नहीं कर सकते हैं at your workplace, if you are at your workplace, you have not done your exercise regime, you can just sit on a chair and then again get up. Do it 10 times. It's perfectly okay. Then you can go do good this staff. You can do this calf stretches. राइट, द काफ मसल्स, जो हमारी जो पिंडली की मसल्स बोलते हैं हम, वो उनके स्ट्रेच करना बहुत जरूरी है. प्लीज यू कैन स्ट्रेच इवन एट योर वर्क प्लेस. यू कैन जस्ट ये पोस्टर में आ जाएंगे, ये जो है ये स्ट्रेचिंग कर रहे हैं, राइट. यहाँ पे फील होना चाहिए आपको यहाँ पे कि आपने स्ट्रेच किया है, राइट. दीस मसल यू कैन डू एट योर वर्क प्लेस इजीली इफ यू हैव नॉट डन एट योर होम, लेकिन ये स्ट्रेचेस करना बहुत जरूरी है at your workplace and at your home also, right. Now just coming to the hand exercises again, which I told you. See, now these are from the when you are at in front of a computer for hours together, you can do simple stretches. You can just hold like this. You can do your hand stretches. First figure, right? You can see it very carefully. You can just take a click of this and you can just repeat it. Then hands up, thoda stretch kiya. Then on your sides, both the sides, you can do the stretches. Then coming back, then you can use your shoulders. Abhi baithe baithe, like I'm doing my shoulder. So you all can do this. Then coming to one neck, just holding this here and giving you a good stretch. You can do this. Then you can move your hands like this. Okay? I'll just show it. Then making it down. Then coming up. Then going down. Right? With one shoulder again, you can do one shoulder raise, other down. अपनी chair पे ही बैठे बैठे you can just twist a little, hold and give this a stretch. Very good. 11th one, and 12th one is shaking your hands like this, keeping them down and shaking, right. So these are the ways how you can continue, right. Footwear you have checked in. I hope I have covered quite a many of the aspects related to ergonomics. Stretches you have seen. These are just brief exercising tips. If you are exercising regularly, if you're going to a gym, or if you're any of the fitness studios, if you're learning exercises, it's pretty good and you should practice it every day. You can practice yoga every day. Yoga and pranayam, definitely it will work you. And then it will condition your muscles to do the activities required, right? So the treatment and cure rest at regular intervals of any activity. If you're sitting in front of the desktop or your laptop for hours, you need to take rest every half an hour. You need to take a break. You can do the stretches. You can move, take a walk, go and come. Don't keep a water bottle just besides you. Rather, if at present, if you are working, people who are working at home during lockdown, Just try to put your keep your water bottle far away, go there, drink, take a sip, and then come back to your place and then do your work. That will give you a good break, right? And then people who are doing long standing jobs, all those professionals who require long standing for hours together, you need to take a walk in between your job. Take a walk, just ये यहाँ से वहाँ जाके आ गए, short walks, then you can move your legs a little bit just on the place. You can do some lifting of your legs, and then that will also help you. And definitely then you can go to a therapist if the problem increases. Then you can use orthosis, as I told you, to improve your posture, and you can use other postural correction techniques. And after visiting expert, then you can practice yoga and proper guided stretching exercises, corrective surgery, that and rehabilitation. I hope this thing, corrective surgery, doesn't is not required to at all to all of you, right? So just be cautious and just take care of all these things. Then a basic healthy life tips can be laugh out loud, LOL, LOL, and then dance like no one is watching. Definitely eat healthy, breathe proper, clap and appreciate. Thank you. I hope I'm clear, and it can be of some productive use to you all. I can start with the question and answer option. I'm done with this. So any queries or anything else you would like to ask related to your hospitality profession, I'm ready to answer.
Sneha ma'am.
Yeah.
Yeah, so there were some questions that are popping in between the chats. So some of this question is, one of the questions was asked by Kaustubh Malani. He said, what if someone doesn't use a pillow? How to, those ergonomic things that you told, how do one, take care of the spine if no one is using the pillow? How can that be taken care of?
That's what I told, that if you're not using a pillow, you need to at least keep a towel roll behind your neck, of a height which can support your neck with your bed. But there should be a support between your neck and your bed. That is very important. You cannot lie down without a pillow. That is not at all ergonomically safe, because then again you'll land up with some other neck problems or maybe shoulder pains.
Okay. Right. And while you talked about the carpal tunnel syndrome, where our front office students, or maybe the front office professionals, they're always on the computer, attending customers, taking queries, solving queries. So they're standing, majority of the time they're standing, and they're using, the screen is down, they're using the mouse. Okay. So what do you suggest for those people who are using the computer is down and they're standing and they're answering the queries for the customer?
Right. For them, right. In that case, they'll have to take frequent breaks. Frequent breaks. Maybe talk to your customer for some time, and then just look at the screen and thoda der wo kaam kar liya, then again talk to them. Try to be more communicative, and that can be done. And also, when you're standing for long hours, if you get even a minute break, as I told you, just walk at your place, and you can get rid of the pains you're getting at your lower extremity in your legs, and that ways, right? And for the screen was down, I would always prefer to have a screen which is of that height, because that is the ergonomic correct way. Right? If you cannot do that, then you will have to take some breaks and do some good exercises for your shoulders and your neck, right? And so that the neck and the shoulders. These muscles are conditioned to bear the load of your neck when you are down. So you have to work hard on your exercises. You have to exercise them and give good stretching, as I told you, as you get a time. Some थोड़ा दी 2 मिनट भी मिला, 5 मिनट भी मिला, just do some good stretching, right? So on जो बहुत सारी stretching होती है जो on the आप अपने जगह पे ही कर सकते हैं. So that can be done.
Okay, and what do you suggest for वो अपने hands के लिए, जैसे not majority of hotels take into account the ergonomic chairs or something like that, because I think they might be a bit costlier. So what can we do to support our hands, and especially the elbow and the hand with regards to the mouse?
Yeah, you can keep your hands, the wrist should not be directly on the tabletop. You can keep a cushion between that. You can adjust your height accordingly. If the chair is not if you cannot adjust that, if the computer is too low for you, you can keep some books or something below the monitor. So that it comes at your eye level contact. If you cannot change your chair position, you can try to adjust the height of the tabletop. That can be done. And then for your hands, of course, you need to use some cushion so that it doesn't get hit. बार बार ये जो पोर्शन है ये टेबल टॉप से हिट होता है, तब आपको यहाँ पे कार्पल टनल सिंड्रोम, यू कैन फील द पेन, राइट? सो टेक रेस्ट. और जैसे ही आपका एक हो जाता है, डू सम रिस्ट एक्सरसाइजेस लाइक दिस, twisting, turning, then some strength exercises. You can have a gripper at home or maybe at your workplace. You can do some gripping exercises, so that, and then some wrist, with a 1 kg dumbbell or 1 kg bottle, you can do wrist strengthening exercises, so that you don't, again I'm saying, if you cannot change your workplace environment, you have to condition your body. That is very important, because you have to get fit according to your workplace, or you have to make your workplace fit according to you. That is ergonomics, right?
Yeah, one of our chefs, Chef Swapnil, is asking, because it's a long-standing job for chefs, they have to stand for 10 to 12 hours serving customers. So what exercises, stretching exercises, do you recommend for the chefs?
Those exercises which I have told in this, इसमें जो पहले दिखाया था मैंने, I'll just, those can also be done. Then again, long standing है तो calf stretching जो exercises मैंने बताई थी, like this one, these can be done at the place also. ये वाला जो first वाला है, this can be done at your place also. With a wall support, you can do exercises. Squats you can use, you can do with a wall support. Again, अगर आपका lower extremity strong है, तो आपका जो lower back है, उस पर pressure बहुत कम आएगा. ठीक है? So it's all about load bearing. तो अगर आपका lower extremity means आपके thighs, आपके buttocks, hips, आपकी thighs और calf muscles, ये अगर अपने strong है, तो हमारा जो load जो हमारी low back के ऊपर आता है, वो नहीं आएगा. So it becomes a safe thing for us. So you need to exercise. You can do it wall squats कर सकते हैं. Then chairs, अगर एक छोटी सी chair मिलती है वहाँ पे, अगर आपके पास में chair है वहाँ पे available in your kitchen, or if you can take a small break and go, just do chair squats. Chair पे बैठना है, फिर खड़े होना है, फिर बैठना है, फिर खड़े होना है, फिर बैठ. You can do it 10 times and you will get again recharged, right? Or at your workplace, then these calf stretches you can do. Hands के लिए, again I told you, hand raises, then hand stretching. यहाँ पे ये वाला stretching exercises. I have a complete chart which I have shown you before this, so that can be done in that case, right? And keep walking. अगर आप नहीं इधर से उधर जा सकते हैं, तो place पे ही अगर आपको लग रहा है बहुत देर से खड़े हैं, तो keep moving your legs at your place, right? Step करते रहिए. On your position, you can keep on.
Okay. One student, Komal Patel, is asking, what type of injury is commonly associated with poor ergonomic design? What are the commonly associated, injuries?
Injuries are usually low back pain, cervical pain, then low back pain. Then I told you due to long standing, you can have varicose vein eventually. Then, then the injuries may carpal tunnel syndrome. Then again, heel pain.
Yeah.
Heel pain is very common because again the footwear, if you're not using the right kind of a footwear and if you have a very long standing job, then you may suffer heel pains, right? So for that also I have told you that calf stretches is very important. Every day if you keep on doing calf stretching exercises, you can find it on Google, calf muscles, lower जितने भी आपके हैं, ये तो मैंने आपको कुछ examples दिए हैं exercises के, there are n number of exercises. You not include everything in one session. So I have just given the best exercises. You can Google in whatever you can do at place. Out of those, definitely you should go for it. And if अगर आपके पास में after lockdown, if you can approach any therapist and ask the person for a good exercise, they can definitely help you out with good exercises, personalized, customized for you.
Okay. And this hospitality, girls especially, as you told, you are not supposed to wear high heels, but then हमारे profession में we have to wear those little heels, थोड़ा सा stilettos रहते हैं. So, we cannot wear flat shoes, but then either in the kitchen we wear those heavy bulky shoes known as safety shoes, or the girls on the front office or the front desk, they are always on a high heel. Now to reduce the pain of the heel, I know I've been using this. तो हील में बहुत ज्यादा पेन उठता है या फिर अपने जो आर्च है वहां पर पेन उठता है, तो क्या कर सकते हैं इसके लिए? जस्ट अभी लॉन्ग स्टैंडिंग भी करना है एंड हील्स भी पहनना है लेकिन पेन भी नहीं होना चाहिए, तो क्या कर सकते हैं?
Right. That's why I included the heel portion, because I know in hospitality, girls have to wear it. You can do one thing is if you have heel cushions, or nowadays heel socks, gel socks bhi milte hain. So that can be more a preventive thing. If you can use gel socks so that they can, they act as a shock absorber, right?
Okay.
तो आपकी बॉडी का जो शॉक एब्जॉर्ब होगा, तो जो जेल सॉक्स मिलते हैं या फिर जेल इवन जेल हील्स मिलते हैं, दैट यू कैन यूज इन दैट टाइम. एंड इफ अगर आपका अलाउ करे, अगर आपका जॉब अलाउ करे, देन यू कैन गो फॉर वेजेस इंस्टेड ऑफ हील्स. थोड़ा सामने से भी हील हो जाए तो थोड़ा एक बैलेंस बेटर हो जाएगा. बट एटलीस्ट ट्राई टू वेयर लाइट वेट. अगर वो हील्स भी बहुत ज्यादा वेटेड रहे, देन अगेन द प्रॉब्लम विल इंक्रीज. तो अगर आप हील्स पहन भी रहे हैं, ट्राई टू बी ऑन अ लाइटर पार्ट, ऑन अ लाइटर पार्ट.
Now there's one student named Meg Karnad. He's asking, how long does it take for a ligament tear injury to heal, and is stretching advisable?
That depends on what degree of ligament injury it is and what degree of ligament, like it takes from 6 to 8 weeks to sometimes 3 months. मतलब you cannot, जब तक कि आपको डिग्री ऑफ इंजुरी नहीं पता है, डिग्री ऑफ लिगामेंट टेयर कितना है, फर्स्ट डिग्री टेयर है, सेकंड डिग्री टेयर है, थर्ड डिग्री टेयर है, यू कैन नॉट से कि कितना टाइम लगेगा हील होने के लिए. एंड डेफिनेटली स्ट्रेचिंग इज नॉट परमिसिएबल in second third degree of ligament tear. अगर थोड़ा माइल्ड है तो मे बी सब acute stage है. acute stage मतलब जैसे अभी हुआ है ligament injury, तो डेफिनेटली अभी कोई भी आपको स्ट्रेचिंग करने के लिए नहीं एडवाइस करेगा. तो अभी तुरंत नहीं, हाँ, लेकिन बहुत पहले हुआ है तो माइल्ड स्ट्रेचिंग के साथ स्टार्ट कर सकते हैं. लेकिन जब तक कि आप आपके थेरेपिस्ट से जाके कंसल्ट नहीं करेंगे, विदाउट द कंसल्टेशन यू कैन नॉट डू इट ऑन योर ओन लिगामेंट इंजरी, राइट?
Okay, now talking about the pillows that you told, किस टाइप का पिलो लेना चाहिए? मार्केट में इतना सारा मार्केटिंग होता है, तो कौन से वहाँ पे जब गधे वाले के पास जाते हैं या फिर if we go to big malls, there are a lot of different kinds of pillows. ऐसे जो फ्लफी से रहता है, कोई फेदर से भरा रहता है, कोई सिंथेटिक कॉटन से भरा रहता है. As an occupational therapist, what do you suggest the normal lot to have? What kind of pillows?
I would suggest that the pillow should be soft, not too soft, but yes, it should be comfortable, it should be soft, एकदम fluffy वाला नहीं, but हाँ थोड़ा जो fluffy रहता है. And then again, as I told you कि ऐसा नहीं है कि अब वो दब जाते हैं pillows, after some time वो छोटा हो जाएगा, फिर आप बोलेंगे ये छोटा हो गया, फिर I have to go and buy another pillow. तो अगर आप नहीं बाय करना चाहते हैं, if you are stocking up with a lot of, you can, what I suggested, अगर वो छोटा हो जाता है, again put a soft bed sheet and make it of your height. You can adjust the height accordingly, right? So अभी जो नया पिलो है, definitely it will be comfortable, क्योंकि अभी जो मिल रहे हैं usually they are ergonomically safe, and you can even check कि it is of a good brand or something. Good brand. Usually nowadays they are giving good pillows only. So even Carlon, yeah, any you can go with जो अच्छे pillows या अच्छे mattresses बनाते हैं, any company, you can buy any pillow. That is not an issue, but not too hard. The pillow shouldn't be too hard, and soft pillows are advisable anytime, because then they can take in the shape of your neck. They can नेक एरिया में जहां सपोर्ट चाहिए वहां वो अच्छा रहेगा और हेड से प्रेस हो जाएगा. सो योर पर्पस इज सॉल्व्ड एनीवेज.
Okay. Okay, Sneha ma'am, it was really nice talking to you, and the way you explain each and every musculoskeletal pains and the different areas and the various exercises that can be taken care of. हमें बहुत सी चीजें अभी नहीं पता चली, especially the one while sitting on the chair and doing exercises. हम तो हरदम when we had pain in the neck, sorry, तो हम we used to bend down. वही हम सामने हाथ रख के सिर या थोड़ा सा रिलैक्स कर लेते हैं. No one thought कि we could bend our head or neck back and then relax. This is something new that we have learned. Even the shoes, आजकल के बच्चे they are rampantly using those pointed shoes. Fashion करना है भाई. But no one knew कि भाई इतना problem हो सकता है. So thank you for bringing that to our notice. I'm really grateful to you for this, for willing to do this session for us. Thank you very much, Sneha ma'am. It was great having you on the Diva Patil portal here.
Thanks a lot, Poonam. Thanks everyone. You all were very cooperative, and I hope the hospitality professionals can, remember this, and every time they can work ergonomically and be safe. Right. That's
okay. Thank you, Sneha ma'am.
Thank you. Thanks a lot.
Thank you, ma'am. Bye.